I'm going to use this. First of all, Justin Crow, thank you for making us clap. Okay, that energized it. You know, yeah, woo! You know, there's pros and cons about going last. First of all, the pro is that I get to learn what all the other presenters have gone through up here. The con is it's not beyond me that I'm keeping you from lunch. So, okay. So thank you for letting me speak to you today. I'm Sharon Davis. I'm from the College of Nursing. I'm also the project director for a HRSA grant. It's a Rural Communities Opioid Response Program Planning Grant. And I appreciate the opportunity to have worked on this because this was a one-year planning grant. It is still going on. We end up on September the 29th. It was for $200,000, but this grant was very prescriptive. They wanted 4 core activities done, and that was to do a community needs assessment, to create a strategic plan, to do a workforce plan, and a sustainability plan. And then there were optional activities that we could do, and the group that convened decided that we would do provider training and also naloxone training for the community, for some community engagement. The way that we went about this was that we had one UT faculty lead take each one of the work groups and one of the optional activities. And as we convened with our community members, we asked for volunteers, and sometimes we did a little bit of coaxing to get them to be co-leads, because we felt it was very, very important that we get our community members involved in this grant. So that is sort of how we went about it. So when we were writing the grant, we looked at 10 counties within the East Tennessee Health District region. We picked these 10 counties because the CDC had identified them as being at high risk for HIV and hepatitis C. Out of those 10 counties, though, we have 3 full counties of Scott, Claiborne, and Cock who are HRSA designated counties, and then we had 2 partially HRSA designated counties, as you can see, and I'm going to try to do this, of 2 little areas in Campbell County and also an area in Jefferson County. So when we were doing our services, we had to do the services within those designated areas. But that did not mean that we could not have people from other counties coming together with us. So the way that we got our consortium members, and we'll talk about that in just a minute, is that when we were writing the grant, and I see Kim Eck back here, her office and the group that first convened were phenomenal in getting letters of support. I've never seen anything like it in my entire life. We had close to 50 letters of support from all areas of the state. So when we started our consortium, I started with that list and sent out notices that we were going to have a quarterly consortium meeting. Our first one was actually in in Campbell County. And we have since had 4 consortium meetings, 1 each quarter. The last one was just last Friday. But we have had people come from all different sectors. We've had providers, health clinics, county leaders, state leaders, county mayors, health departments. We just are getting in the faith-based community over here with MARTA. Some treatment centers, drug coalitions, Tennessee Department of State Office of Rural Health, EMS, OR&L is on board with us. And probably my favorite group are these with lived experience, because you can learn a ton from them if you will just listen to them. So the first thing that we worked on was a community needs assessment. And Dr. Lori Meschke from the Department of Public Health here at UT led that. And along with her co-lead was Danielle Sims from CAPA, Knoxville Area Project Access, which is, of course, Knox County, but also some of Scott County. And what they did was that they looked at the existing data. And just some examples of the data that they looked at was the Tennessee Department of Health Drug Overdose Dashboard, Robert Wood Johnson, some of the surveillance system, the behavioral risk factor surveillance system, looking at the existing data. And then we did 2 primary data collection efforts, which was an amazing experience. We did the community strength and themes assessment. We sent this, well, let me back up. We did this 2 different ways. We did it hard copy and we did it online. Okay, when we did it online, we sent it out to our consortium members and we said, send it out to your networking. We had 710 respondents to that survey. So if we're talking best practice, know that you can get most of these done online. We only had about 50 hard copies, 54 maybe. The other 600 plus was done online. And we had representation from every county, every one of the 10 counties that we were working with. The other thing then that we did was we did a local public health system assessment. And what we did was that we looked from the survey, looking at different strengths and so forth of what we had in the community. And one of our consortium meetings then, we had discussion groups. We had people from the different sectors to take a look at their sector and decide what sort of assessment that we had. So we've pulled that all together. This part of the grant has been completed. It is online, and I'll give you our website. We have created a website. It is about a 37-page report. It is beautiful. It is very interesting, very complete. But that report has been done and has been very informative. The next thing that we did, of course, from the community needs assessment was develop a strategic plan. Lori also led this group, and her co-leads were Deborah and Keith Schultz from Rescue 180. I think I saw Keith in here. Hey, Keith, from Jefferson County. They did an amazing job. The work group got together and did some of the work, and then they brought it forth to the consortium members. And during that consortium meeting, we had about 10 priorities that we were looking at, or 10 different things that we were looking at. And believe it or not, that group of people, and we had about 60 people there that day, which is just amazing. We came up with these 3 top priorities. Now, not to say that we're not going to be looking at the others, but these were the top. Does any of this surprise you at all? Mental health, stigma, treatment and recovery services. It's everything that we've talked about for the last 2 days. So this plan, where this plan is right now is it's going to go before 3 town hall meetings the first part of September, and then will be finalized. What we have talked about with the mental health programs so far, I wanted to just highlight this a little bit, is to look at community and professional, the sectors, the focus. We're looking at telehealth. We've talked a little bit about telehealth during this conference. Mindfulness, looking at some alternative measures, and expert screening for healthcare providers. Youth focus, looking at youth mental health prevention, which we know is needed. If you were here and heard the discussion about suicide, the assessment study of youth with NAS, and then parenting classes. So that's sort of some of the mental health programs that we're looking at. As I say, this has not been finalized, so we're still working on this in development. For stigma reduction, we want to look at digital storytelling. We know from the literature that that best practice to reduce stigma is to teach about the science of addiction and then tell positive stories. That's why Dr. Steve Lloyd is so powerful. He's the whole package. He can teach it, and he is a positive story. So we want, though, to also do digital storytelling because it is therapeutic for patients, for those in the midst of addiction, but also to look at the providers, to look at grandparents. We are Appalachia. We love a good story. and it's very therapeutic. So to be able to do some digital storytelling, to show some people's stories as we go around and teach about the bias training and the intrinsic bias, to do that all together, we know can be very powerful. The other thing is to train the trainers for faith-based communities to help faith-based communities become certified in being recovery services. And then treatment and recovery services program to help people with Medicaid enrollment is one thing that we want to do. And then training for potential MAP providers. We understand that, we do not have a lot of providers out in these counties. We may have some primary care providers that as we teach them about MAP, that may be willing to do that. We also like the idea of telehealth and echo to keep them with constant support so that they feel supported and not out there alone. Also talking about putting MAT in the safety net program. And this, of course, will have to do with some legislation and so forth, but to think about how to get this service covered financially. And as I put down here, this strategic plan is still in development. Workforce plan, the UT lead on that was Dr. Pam Hardesty from the College of Nursing, and then she had Mr. Tom McLusiak from the American Jobs Center, the Tennessee Department of Labor and Health Force as her co-lead. They looked at, of course, the community needs assessment and then looking toward the strategic plan. And they've come up with some goals so far. One is to advocate for APRNs to provide full practice authority, which is lacking in the state, including the ability to provide MAT, to fill, of course, we have a dire need for practitioners in the rural counties. The other thing is to increase the number of trained practitioners in the region through the National Health Service Corps and any other existing programs that we might find, and increase the number of providers with a waiver to prescribe buprenorphine. And then also, because one thing that we've heard being out in these counties is that we get providers in here, they get their loans paid for and they're gone because there's no infrastructure, there's no reason for them to stay in these counties. One thing that we've talked with the federal authorities about is because these people have to live in those counties, is to take away that barrier. So there are some barriers that could be brought down about that. But also there's other strategies and so forth to help these communities retain the people that are in their communities. One thing that I've learned about and talked about is for the counties to grow their own. Go into the high schools and see if there are students there who want to go into these fields and help the county help that student go to school. And then the students stay in that county where family is and where they're invested. Again, the workforce plan is still in development. And then the sustainability plan, I'm over this, and Mr. Stacy Rose from Region 2 Emergency Medical Directors Association is my co-lead. He is the state. He lives in Union County, though, and he is EMS there. We have our goals done, but we just got last Friday some input from our consortium members. So as our work group has developed the goals, we want to now combine and synthesize those goals with the feedback that we got last week. And then we also, as with the workforce group, will be attending the 3 town hall meetings. Will be in Claiborne County, Cocke County, and Scott County to do these town hall meetings the first part of September. And once we get that, then we can finalize the sustainability plan. But one thing that the goals that we've come up with so far is to maybe transition to a new executive team or have a board of directors. Right now, the executive team are the UT leads and the co-leads. That is not going to be sustainable, so we're going to be looking at creating a new executive team, or the possibility came up, someone mentioned Friday, about a board of directors. So we're going to be looking at that. Of course, we're going to implement that strategic plan, and we've already started some work on finding some work groups to do that work. Develop evaluation measures. Anytime, as we've heard, that you're going to sustain a program, that you got to measure what you're doing, and you've got to let the communities know what you're doing and where you're successful. We also talked about doing the PDSA the Plan, Do, Study Act for quality improvement. And every time we have a program, we look at it and we see what could we do better and implement that then the next time. Communication is key. We've heard about that. You need to be transparent. You need to communicate with the stakeholders and with the public to let the public know what you're doing. And then also funding strategies. The one big thing that I've heard from these rural counties is we don't know how to write grants. And we sure don't have the ability to do the financial part of it. So we want to collaborate to help them write the grants, to see who the best person would be, the best applicant would be, to be able to get some funding into this arena. We have had one opportunity to collaborate with Rob Pack from ETSU, West Care over here, Ballot Healthcare, and Roy Meshke and I were on this call to do a Bureau of Justice Administration. Judge Sloan wanted to do that. It was determined that West Care would be the best people to do that at the time. And so that collaboration is ongoing. One thing that I'll tell you that I love about this is that when it comes to working in this field, people are not proprietary. It's whoever can do it, let's get it done, and let's get these people stopped hurting. So the optional activity that we did was provider training. That was led by Dr. Sadie Hutson, now the College of Nursing, and Scott Hurst, Tennessee Department of Corrections. And we are doing 4 sessions. We had 2 face-to-face, and we're doing 2 online activities. The 2 face-to-face sessions have been completed. We've had 41 providers, and not just healthcare, we're talking social workers, et cetera. Attend those meetings. The 2 online sessions are being they're being out there this week. We're going to launch them this week. We did provide free CEUs to physicians and nurses to the first 10 that registered. Some of the content that we covered was chronic brain disease. Dr. Lloyd came and did that. Of Judge Sloan came and did that. I covered ACEs. We had Dr. Brian Wimbigler from the College of Pharmacy come and talk about the CSMD. And we had Dr. Sagar Javandi from UT Extension do motivational interviewing. And then I did a module on expert training. The optional activity was community engagement, and this was Dr. Sagar Javandi from UT Extension, Dr. Nan Gaylor from the College of Nursing, and Terry Sabella from Tennessee Primary Care Association. The community engagement was for naloxone training sessions. We've completed 2 of those with 17 attendees. 2 more we were just absolutely talking this morning about dates and venues. So those will be pretty soon. And then communications, we have Dr. Beth Foster and Dr. Jenny Crowley from the UT College of Communication and Information. They created us a website. Up here is the website address. They also put us out there on social media. They developed our logo. These ladies have been awesome with pushing some of our training sessions out on social media and so forth, and creating flyers for us, helping us get reports done. And as we say, they do their magic, that they get that they did the community needs assessment report, pulled it together, and made it just look so very professional. So that's where we are with communications. And that is all I have. Thank you.